Yeah. So we have our next young speaker, Dr. SUPRIYA SAMAK Sri Ganesh, who is a young consultant and phaco and refractive surgery in Netradama Super Specialty Hospital, and she's going to show some gymnastics to us in the next few minutes. On to you, SUPRIYA.
Good afternoon, everyone. At the outset, I would like to thank Chitra ma'am, AIOC, and ARC for this opportunity. Very honored to be here. So today I'll be showing the video of, is my screen seen?
Yes.
Okay, so this is a dense, almost black cataract with a mid-dilating pupil. It was around 5 to 5.5 mm. So I'm just going to play the video. So here I'm making a simultaneous side port and a clear corneal incision using a diamond blade, the side port. I like to stain this capsule and wash off the stain. Here, the pupil is too small. So to be on the safer side, I'm using a Maligan ring to expand the pupil. It comes with its own injector. And while the last loop, I use a collar stud dialer to actually expand the pupil with the last loop and use the injector itself to put it into place. I'm using a cystitome to do the capsulorhexis. And if you notice on the right side of the capsulorhexis, I do leave a part of the stained part of the capsulorhexis just so that I can see the capsule edge. Very good hydrodissection is important in such cases while using this device called the MyLoop device. So I'm just going to pause here. This device is called the MyLoop device. It's actually a nitinol filament loop, which is 300 microns thick, and it has elastic properties. So it expands up to 10.5 millimeters. So what we do here is we expand the loop beneath the anterior capsule, and it expands all the way to 10.5 mm, and this encircles the entire nucleus. Here I use a second instrument to stabilize the nucleus. There's a retractor which can retract the loop and divide the nucleus into half. So with such a hard cataract, it's very useful to use this and reduce the phaco energy. Here you see that I'm rotating the nucleus, but not completely horizontally. It's a little oblique because for the second cut, when we go in, the opening up of the instrument itself rotates the nucleus a little bit and it comes into horizontal position. So here you see the black band on the instrument. It has to be there at the incision. That's the correct position. With the second instrument, actually it holds down the nucleus and prevents it from tilting up. So at this point, I'm using viscoat to deepen the anterior chamber and start with my phaco. Here you see that the nucleus pieces are cut through and through, and this really helps bring it out from the bag, and the phacoemulsification is much easier. Of course, it can be chopped into smaller fragments if it's difficult to remove the first fragment. I keep injecting viscoat again and again to protect the endothelium because, as you can see, it's a rock hard nucleus. I'm keeping my chopper right above the fragments so that the fragments don't fly and hit the endothelium, just to protect the endothelium. The very last piece, I do try and chop it further after injecting viscoat again before emulsifying it. So actually this instrument has helped us reduce the phaco time and phaco energy quite a lot. And it uses centripetal forces, central forces rather than centrifugal forces to actually divide the nucleus. Now here, when I'm injecting the lens, what happens after all that work is that the trailing haptic actually gets stuck in the cartridge. So I try to push through a couple of times and that doesn't work. So I I retract the injector and then try to push again. I retract it completely and try to push again. And luckily the trailing haptic finally goes in. And then I dial the lens in with a little more viscoelastic. Now to remove the lens, I use a remove the Maligan ring, I use a collar stud dialer to release the trailing loop. And with the injector itself, I hook it and retract it back into the injector. So this is an easy way to actually remove the ring. So that's the end of the case. Just remove the viscoelastic and hydrate the wounds.
Wonderful video, Supriya. A very challenging case, and your tips for how to place my loop and how to do about it was truly amazing. As if you were a very seasoned surgeon. So, kudos to you.
Thank you so
As
much.
far as the questions are concerned,
Yes.
I just want to know the pupil was moderate size. Is it because to use a my loop you need to have a larger size pupil made you use the Malugans ring?
Yes, ma'am. This was just to be on the safer side because to use the MyLoop, and since it was such a dense cataract, for better visualization, I decided to use the pupil expander.
Would you feel that using iris hooks would help better than a Malugan ring crowding the area and then you needing to put the my loop inside? Just a thought. Anybody in the panel could answer me. It is a genuine doubt I have.
Ma'am, actually, the Maligan ring doesn't really crowd the AC too much with whatever cases that I have done. The thing about iris hooks is, again, multiple incision. Of course, it would give you a better exposure, but in this case, the Maligan ring expands to about 6.25 to 6.5 mm, which I felt was enough to manage in this case. And to use the MyLoop, actually, it doesn't crowd the AC too much. The MyLoop actually is quite a thin instrument, even though it looks quite bulky in the anterior chamber. It's easy to use and manipulate.
Yes. So going further, this is another way of skinning the cat. Just one question I have is to the expert panel. If you were to be on the flags and you have this kind of a hard cataract, what would be your segmentation pattern and spacing? And that's what I want to ask. Ramurthy and Swapna.
Oh, either the two ways of doing it. Either you can just use a grid pattern and just use a 200 microns grids, very small grids. Otherwise, you can use softening as well as segmentation. Usually a really hard cataract, I go ahead and use 8 segments with a softening of about 300 microns, a combination of the both. That, of course, increases the amount of time for which the FIF2 has to fire, but that's not too deleterious. And usually I keep the offset at only 500 microns.
Yes, Swapna?
Yeah, I think that's pretty much.
Okay.
On the FEM2 platform, even I would do the same. With it would be a grid with segmentation.
Yes. Very good, Supriya. So